state's reopening plan is leading to a lot of questions, from fears about a second surge to weighing the risks of going to see your family. Dr. Mallika Marshall answers some of your coronavirus questions.
Joanne says she wants to start babysitting her 6 grandkids, but one parent works as a nurse on a COVID floor and one works as a policeman. Is it safe to do so? So the kids are at higher risk of being exposed to the virus because their parents are in high-risk jobs. And even if the kids don't develop any symptoms, we don't know if they could possibly be asymptomatic carriers of the virus and therefore put older people at risk of developing the infection. So it would probably be wise to wait, since as a grandmother, I'm assuming that you are probably in a high-risk category, but you can certainly call your doctor and ask their advice. Our next question comes from Anita, who writes, my husband's older and scheduled to start physical therapy soon. I'm concerned it still isn't safe to go to the PT center. So most medical facilities are perfectly safe to go to right now. They're taking extra precautions to protect the patients as well as their staff. So your husband will need to wear a mask. They will ask him whether he has any COVID-related symptoms. You may not be able to go into the facility with him. You should make sure he disinfects his hands when he's done with his appointment. But in general, it is safe for you to go to your medical appointments, and we encourage you to do so. Matt says he's itching to play golf, but he's concerned. My gut tells me that a second surge is coming because the public is letting down its guard. So I completely understand how you feel, Matt, because as we open up, there are going to be more cases out there. But I have to say, in terms of sports, golf seems to be relatively low risk, and that's because it's outdoors. You can wear a mask, you can socially distance, you don't have to share equipment. But if you're at high risk of COVID-related complications, you may want to continue to wait. You can talk to your regular doctor about that, but you certainly shouldn't do anything that you think is going to compromise your health. Our next question comes from Elizabeth, who writes, my car is due for its annual inspection sticker. I'm at high risk and am anxious about having a stranger inside my car. Elizabeth, I totally get it, but fortunately, the RMV has been extending inspection stickers for at least 60 days. So, for example, if your sticker expired in May, they're giving you until at least July to have it renewed. So check with the RMV, because chances are you can actually wait a while longer.